All right, it says live. Hello, everybody. I'm Robert Breaker, and see if I can. Okay, it's coming up for me to hit mute, so I'm hitting mute there. Of course, it is nice to hear if I can hear. Okay. All right. Hello, everybody. Robert Breaker here, and I have my wife Laura with me today, and we also have a special guest named Jessica, and we're going to be talking today about midwives. So, Laura, why don't you say hi and then introduce your friend, and we'll take it from there. Go ahead.
Jessica!
Hello!
Okay, so everybody, this is Jessica. She's my bestie, and she has a long career in healthcare, but especially midwifery, women's care. Let's see, you started out at an old folks home, actually, right? LPN, old folks home.
Yeah. I was actually a nursing assistant. I did all the dirty work.
Right. I was there. That's probably the hardest job, is working with them. That's kudos to you. And then you were an RN for a long time. You did some contract nursing up in Maine and California. Am I getting all this in?
Yeah. We went all over the place in Rhode Island, Massachusetts.
Rhode Island.
Yeah. California, still there.
And then you started studying midwifery.
Mm-hmm.
Not midwifery. Not midwifery. and you got your midwife license, and then you joined the Army. Dum dum dum. So you were an Army midwife.
Correct.
At the time, I did not know the Army had midwives.
I did not either when I was in midwifery school. It was a friend of mine who was prior service who told me, "Oh, I'm going to join the Army again after school." And I was like, "Oh, sounds like a good idea."
So was it a good idea?
Yeah, it was. I don't have any regrets. Okay. The Army part was interesting, but taking care of soldiers and soldiers' families, that was pretty darn spectacular.
But now you are super focused midwife at a hospital, right? And you're not just a midwife. What's your official title?
I am core faculty for obstetrics and gynecology at the hospital. So it's a teaching hospital. We have residents and medical students. I don't do a lot with the med students, but my main job is teaching interns in their first year. So the first year of residency, it's all me and the other pack of midwives, because during their first year, their focus is on normal, healthy, with a few deviations from normal. And that's our specialty. So they let us teach them. And then as they move on through their residency, they learn more from the obstetricians because they're the surgeons.
Nurse practitioner, right?
Yes.
Nurse practitioner. But you're also an RN, and you were once an LPN too. Is that right?
I was never an LPN. I was a CNA, then an RN, then, with midwifery, you have to have an RN for the type that I am. So that's like a tack on to my nursing degree.
Okay.
Do you still keep those titles, or is just nurse practitioner now?
No, I do. So I'm Jessica Dempsey, RN, CNM, ARMP, MSN.
PQRST or whatever. No. Esquire. No, you can't be Esquire. That's something else. Okay.
So what you're doing. You've been in this for a while.
Yes.
So you're a good guest because you're so experienced, and that's one of the reasons why we want you on, is for your experience. But already we've had 2 or 3 people ask, "What's a midwife?" So I think we need to start there. And I wanted to give a couple verses also, because here on this channel it's about God and the Bible and things like that. And so midwives are in the Bible. So that's one of the reasons why we're going to talk about this. And I wanted to give a couple verses about it also. But first off, before I do, what is a midwife? And what would you call it? The occupation is called midwifery. I think that's such a neat word, midwifery. How would be the best way that you would define, Jessica, a midwife? What a midwife is?
So a midwife is a person, man or woman, who provides care to women through the lifespan. So it starts in the teen years for well checks. It goes through adult years for wellness checks, birth control if you choose to be on it, care in pregnancy, delivery, and also care of the newborn up to 28 days of age.
Okay, so that's more than I thought. Okay, but I'm glad you say it can be a man, because I feel like I was a midwife with our first with Emma, because I was there and I helped catch it come out, and so that was kind of fun. But in the Bible, what midwives are, and it's kind of simple, is they were there when a woman was about to give birth. A midwife came to the house and helped the mother. And there's lots of verses. I noticed that I looked this up in the Bible today, and there's 10 times in 9 verses in the King James Bible that we have midwife or midwives. And I thought that was interesting. In 9 verses, 9's the number of fruit, and that's, you know, what the baby is, the fruit. And I don't have time to read all of the verses, but I thought I'd just read 1 or 2 here. In Exodus chapter 1, probably the most well-known verse, and I'll go ahead and I'll try to share screen here too so people can read this with us. And the most well-known verse about this is when the children of Israel were in Egypt. And what happened in Egypt? Well, over here in Exodus, Laura, you tell me if you can see this. Coming up the screen. I need to make it bigger so people can read it here. Exodus 1:15, and from there on. And the king of Egypt spake to the Hebrew midwives, of which the name of the one was Shiphrah, and the name of the other Puah. Weird names. And he said, when ye do the office of a midwife. Now, I thought that was quite interesting. It's an office, you know. We today, we think about in a church, we have an office, and the office is the deacon, the pastor, you know, things like that. But Bible actually calls it the office of a midwife. That's a pretty interesting thing.
Pretty official.
Yeah, to the Hebrew women, and see them upon the stools. If they be a son, then ye shall kill him. But if it be a daughter, then she shall live. But the midwives feared God, and did not as the king of Egypt commanded them, but saved the men children alive. And the king of Egypt called for the midwives and said to them, why have you done this thing and have saved the men children alive? And right there we see that the midwife, she cares about the child. She wants to see them live. That's her main goal, is to have a healthy birth. And the midwives said unto Pharaoh, because the Hebrew women are not as the Egyptian women, for they are lively and are delivered ere the midwives come into them. Therefore God dealt well with the midwives, and the people multiplied and waxed greatly. And it came to pass, because the midwives feared God, that he made them houses. I just noticed that today. I was like, made them houses. And then it goes on. So people in the comments have already started by saying a midwife is just somebody that comes to your house while you have a baby. But that, and of course that might have been for many years, but we've been to birthing centers. So there's actually places that you can go and have a midwife. Yeah. You don't just in your house, you can actually go to a place. Go ahead, Laura. Get this. You
just went out for like 4 seconds for me, so I don't know if anybody else heard that, but
what did it?
So a midwife isn't just someone who comes to your house.
Right. There's actually houses. Yeah, birthing centers. Right. Or well, you work at a hospital as a midwife. So it's not just in your home. A lot of people, they think of midwives and they say, oh, that's scary to have my baby at my home. No, I want to be somewhere where there's a medical person. But no, there's birthing centers. There's places you can go, or you can have them at home as well. Either way. What do you say about that?
So you're absolutely right. And actually, I've run the spectrum personally, and my own, I have 4 children, and I had 1 miscarriage in the mix there. And for my first, he was born in a hospital with doctors, which was what made me decide I needed a midwife for my next delivery. But he had congenital heart defects, so it was one of those things that needed to happen. We needed to have access to the neonatal intensive care unit. And then my next baby was born in a freestanding birth center in Sarasota, Florida, with a midwife. My next kiddo was born at home in California with a midwife. And then my fourth, my daughter, was born in a hospital because I was in the Army. And when you're in the Army, the government owns you and tells you where and when you can and can't give birth.
Wow.
Like nails on a chalkboard, but it's the truth. So the silver lining there was I worked with a fabulous pack of Army midwives who completely guarded my birth for me and gave me the home experience in the hospital, which was great.
So if you're in the military midwives are in the hospital. They don't come to your home.
That's correct.
I didn't know that. That's interesting. That's a good thing to know. So Laura and I, we got into this. because we met a man, and we met him in Mexico. He came down to Honduras. He was a missionary, and we drove with him through Guatemala and different places. And older men usually have much wisdom to teach younger men. But also in the Bible, it says that the older women are to teach the younger women in Titus chapter 2. So this guy, he was telling us about how he had midwives, and he taught us about midwives. And midwives are in the Bible. And, for 6,000 years, women had midwives. There were no hospitals back there in the old days. So, but today people think of midwives and they think, "Ooh, no, I don't want that. That's barbaric. But a lot of times you get much better care with a midwife than you do in the hospital, because the midwife, many a time she's a mother herself. She's been through it. She knows what you're going to go through, and she's there to give you comfort, to take care of you. She knows what's about to take place. Doctors, a lot of times they're like, "Oh, my tea time, I've got to go play golf," and they're like in such a hurry that they're not really there to give you that much care or concern even. And oftentimes they do things. Well, I don't. We'll probably get into this, but many hospitals have quotas of how many C-sections they have to do, and oftentimes the doctors will just do a C-section just to get it over with, and not have it more natural. And Laura and I, we want to do more natural things. We want to get back to the basics, back to the Bible. We've talked about homesteading and prepping and things like that, and all natural medicine here on our channel as well. And we always try to tie it back into the Bible. So I went there to say this. This older gentleman, he told us about it, and he gave us a book. Remember what the name of that book was, honey? What was it?
The Diary of a Country Midwife
by Willa Schaefer. And I read that book, and that got me excited about it, because Laura was already excited about, having a midwife. But a lot of times the guy, he's like, "Oh, what could go wrong? I don't want anything to go wrong with my wife or with my kid." But that book was really amazing, written by a woman from Alabama. And what's the deal now, Laura? Alabama is totally against midwives, unfortunately. And that's a bad deal. But Laura, do you want to tell about our kids and how we had them? Jessica just told about hers, and tell why you chose, Laura, to have a midwife.
Well, I think between Jessica and I, we've, like she said, run the spectrum of how you have kids. My first was in a hospital, second was at home, third at a birthing center, and fourth, Conrad was with a birthing center. And it's very easthe for me to say, I sure like that home one better. And I don't know how it is with you and the people that you see. Do they ever have a home birth and a hospital birth and say, I'm gonna have my next one at a hospital?
I personally have not seen that. Usually once people have a birth with a midwife, especially if it's at home or in a birth center, there's no going back. And honestly, like I said, the only reason I had my last baby in the hospital was because I had to. I would have, if I had my druthers, I think I would have actually gone with the birth center, only because there's a pack of people there who clean. You don't have to worry about anything, and they feed you. And
it's not your house. You're not dirtying your own house.
Right. And then I go home and I get my own bed, and it's great. I mean, I loved my home birth. I had a blow up tub right in front of my fireplace. It was really nice. But I'm a fan of the birth center, I must say.
My birth center births were very cool. I like them. And I'm getting ahead of myself. So let's way ahead of myself. Honey, what was your question?
Well, here I wanted to, reiterate a little bit. So our first one was in Honduras, and we had to go to a hospital because, unfortunately, at 8 months,
think we had to go.
The baby passed away, and I kind of freaked out a little because, it wasn't alive anymore. And so we went to hospital, and you had a birth. But the second one was at home, and you bought one of those. Well, we rented one of those big tub, and you were in hot water. I mean, it was like jacuzzi almost. And what a wonderful way to have a baby at ease in hot water. The next one we went to.
I love how he says at ease, Jessica.
Right, it's so easy.
It's so easy for him to say at ease.
To me, it wasn't just you were more comfortable than you would have been if they put you and strapped you down to a bed and did it the way the doctors like to do it.
Compared to the hospital birth, it was
But
It
what
was
I saw was how
awesome.
amazing it was for the baby. When Emma popped out, she comes up from the water, and she just looks around, didn't cry or anything, just like, well, this is different, and just kind of looked around. That was amazing that she didn't
And
cry
the
or
baby's
anything.
not drowned in the water.
Right. Because they're in water inside the mother. And then the next one we had, at a birthing center, and we had to drive, it was an hour away at least, wasn't
That's
it?
an hour away.
And then the last one we were going to have in Mississippi at a birthing center, and we ended up in Niceville, Florida. So, and that one you were in a big tub, in a big hot tub. So I would recommend women, like some of the ladies that have been emailing and asking about this,
Well,
they should Google that and look that up, because that's a wonderful way to have a baby in water. Go ahead, Mom.
Can I
Mama?
just take over
Sure.
a little bit here? So I have in my notes to start with Hosea 4:6. My people are destroyed for a lack of knowledge. I'll read the whole thing. Because thou hast rejected knowledge, I will also reject thee, that thou shalt be no priest to me. Seeing that thou hast forgotten the law of God, I will also forget thy children. And I think it's a little interesting that we're talking about children and babies, and also my people are destroyed for a lack of knowledge. Jessica, do you see people suffering needlessly because they just don't know that they have an option of a midwife?
Yeah, and I mean, it goes actually even deeper than that. Not only do they have options in prenatal care and childbirth and postpartum care, but also when you have that individualized care that a midwife provides, because by default we have longer appointment times, we have a greater focus on education. So we talk about things like nutrition and activity. This sounds very basic, but in pregnancy there really needs to be an emphasis on it. That's going to potentially save you from preeclampsia, from gestational diabetes, from complications that would cause you to risk out of midwifery care and have to deliver in the hospital unless you choose to have an unattended home birth, which I don't recommend necessarily either. I have friends who do that and they're comfortable with it. And I'm like, oh God, please let it turn out okay. I'm a fan of having a trained person there, but the lack of knowledge, that's actually, believe it or not, a medical diagnosis, knowledge deficit. And we have a problem with that. And I don't know if it's because the focus is so much on the baby, like in standard OB care, where it's just like, oh, listen to the heartbeat, measure the belly, make sure everything is okay, and then send you packing as long as the baby's healthy. You are the mother. You are the body who is growing this baby. Yes. And so if you're not taking care of mom, you are not taking care of baby. So I think by emphasizing the little pieces that are so big, the education, the not just, how to eat and how to act and where to go and what to do when you're pregnant to help things be better, what herbs to take, what vitamins, what things to avoid, because now we're learning about folate and folic acid and MTHFR and all of these things that we didn't know before. If we're not having these conversations, then we're not doing justice to these families. And then further than that, options in childbirth. Some women want to be in a hospital. They feel most secure there. And I say you're going to birth best where you feel safest.
Where you're comfortable.
Yeah, exactly. So if that's a hospital birth, there's people like me out there where you can have midwifery care. We have what we call high touch, low tech rooms where you're not monitored all the time. It's a big queen size bed. There are jet tubs in every room. So it really does mimic that home-like setting, but you have all of the emergency care readily available if you feel like you need it, or if your partner feels like they need it, because sometimes that's the case. And then if, what do you want for pain management? Do you want to go all natural? Do you want to try the nitrous, the laughing gas? They have these other options other than epidurals that allow you to maintain your mobility. And I can't tell you how many people who I admit every day when I say, what's your plan? And they say, go with the flow.
Yeah.
Yeah.
My life is in your hands. Right. I don't know.
And I feel like I would take good care of these people and do a good job, but I'm like, please come in with a plan, please. Yeah. I want you to have the experience that you want. And when you don't even know what you want, how do I know how to take care of you best, you know?
Right. Laura and I talked about this and how in America they've been indoctrinated from like the 50s that it's like pregnancy is a disease. Thing. And when you're sick, you go to the hospital, but it's not. It's a natural thing. And so in America, when you say, I have a midwife, people look at you like, what, are you crazy? But in Europe, it's the exact opposite. In Australia, you have your babies with midwives. And someone goes, what, you went to a hospital to have a baby? What, are you crazy? So it's completely different thinking in other sides of the world. And so I want people to know that this isn't quackery, what we're talking about here. This is something that people have done since the beginning of time. And you do it correctly, you do it right, you plan, you do this thing correctly. And midwifery for my wife and I was the right thing to do, the best thing to do. And a lot of people say, oh, you're crazy, we should take your kids away, you had a midwife, because they think only a hospital. But no, our midwives, we would go there, they would check, they would check and make sure the baby's okay. There is a lot of the good that comes from midwives if you do it correctly. Go ahead, Laura.
I was just going to ask you about the statistics. It's actually safer, isn't it, Jessica? Under normal circumstances, to have a baby with a midwife than in a hospital.
Well, yeah, and I think a lot of that is also the data pool. So when you look at home birth or birth center birth with a midwife, if a midwife is doing things correctly, then she should have risk criteria. So if your baby is breech, then she would recommend at least a consultation with a doctor to try to turn the baby, and then a C-section if not. I know breech is a variation of normal, but we are not trained these days to deliver breech babies, and those who are trained are few and far between, but they do exist. If you have severe preeclampsia, you need to be in a hospital. You need to be on IV blood pressure medications. You need to be on magnesium. It's of vital importance. But when you're talking a birth center birth, where a midwife has risk criteria and you stick with the normal healthy, with a few variants, sometimes people have a high blood sugar, but she can manage it well through diet or something like that. That's a variation, but it's acceptable. It's definitely been proven to be safe. I mean, I'm looking here, there are 2 studies, huge studies that have come out recently. There's this one. Can you read?
Yeah, I'll read the title anyway. Yeah.
Okay. So it's Outcomes of Care in Birth Centers, Demonstration of a Durable Model. And then the other is Outcomes of Care for Over 16,000 Planned Home Births in the United States. And what it showed was that we have high rates of vaginal delivery, low rates of transfer, low rates of episiotomies and other interventions in labor, high rates of exclusive breastfeeding, which is important. It's got incredible health benefits for mothers, incredible health benefits for babies. And that's not something that's usually emphasized in most hospitals unless they're credentialed as baby friendly. But the chance, basically what it all boils down to, of your baby dying, because that is what everyone is terrified of when they hear out of hospital birth, right, less than 0.5% chance.
Wow.
But it does happen, just as it does happen in hospitals. I mean, tragedy is real. And I think people are quick to jump on, oh, it's your fault because you had a home birth, or because you weren't, you didn't have something readily available, or, NICU care, whatever, and you had a bad outcome. The same things, I'm here to tell you, because I'm in the hospital, the same things happen in hospitals as well. And then deeper in these studies, they show that of the poor outcomes that are reported, because they do have to be reported, over half of them were babies who had gotten to term or near term and passed away in the womb. So it was not an issue of care. It was an issue of just a real tragedy. And then a small percentage, I think it was like less than 10%, but they were babies who had known lethal anomalies. They had a real problem that was not compatible with life, and the families knew this, but pursued midwifery care because they wanted those precious moments that they spend with their baby right after birth, the ones that they would probably only ever be able to spend, to be protected and to be guarded, and to be quiet and peaceful and on their own terms.
Right.
And then, so that leaves a little less than half of those poor outcomes that were legitimately just bad. Baby didn't transition well, they transferred appropriately to the hospital, and kiddo just didn't survive. So, and again, that brings us to same thing happens in hospitals, even with everything available.
So if it's so safe, Jessica, then why are states like Alabama trying to push out midwives and not have them?
Oh my gosh. Okay. So we call this the good old boys club amongst midwives. And I would like to think that as OB doctors are trained up, like the folks that I'm training up, they have exposure to midwives and they know what we do and they know our scope and they know that we know our scope and are comfortable with that. But what you have is a lot of obstetricians who are older in their careers. They've been doing this for 30 years plus, or who were trained by these same individuals with no exposure to midwifery, who view us as a threat or who view us as dangerous. A threat because the rates of home birth and birth center birth have risen by like over 40% in the last several years, because women are realizing their options and taking note of that and doing it. And then also because they feel like if we mess up, because we're human and we do mess up, that will somehow be on them as a supervising physician. So just so you know, midwives are independent practitioners. I carry my own malpractice. My mistakes fall on nobody's shoulders except my own. But they don't realize this. They think they hear supervising physician, which means if I have a lady who risks out of my care, I have someone to transfer them to, or if I have a problem that I'm not 100% sure how to deal with it, I have you as a resource. That's what a supervising physician is. But they hear the word and they're like, oh my gosh, if a baby dies, I'm going to be sued. My house is going to be gone, and so they say no midwives. They view us as a threat or as a danger to society or their jobs.
Yeah.
But there are grassroots organizations, I know, in Alabama and in the few other states that are not midwife friendly, really trying to turn that around, doing a lot of hard work to turn that around.
Does every state have to have a supervising physician?
No, it varies. Okay. So there are different types of midwife. There are lay midwives who are what we call the granny midwives. They were taught apprentice style. They don't hold a license, but they have extensive training in midwifery care. There are licensed midwives and certified professional midwives who are trained in like a 3 to 4 year program, but they don't hold a nursing degree. It is strictly midwifery. And then there are certified nurse midwives or certified midwives who are actually few and far between. They hold a master's degree or greater in another field, like biochemistry or whatever, and then they go on to get their midwifery. So they do exist, but not many. So certified nurse midwives and certified midwives are legal in every state in some capacity. But usually in states like Alabama, they are just
haven't certified anybody.
Right.
They're legal, but they just haven't certified anybody since the 70s, so none exist.
Right. Or they'll say, oh, you can take care of women in the office, but you can't deliver babies, or you can provide well woman care and right for birth control, but not deliver babies, So there is some oppression in that way. Lay midwives are, I would say, tolerated in some states. Women tend to fly under the radar when they're lay midwives because you can be accused of practicing medicine without a license, which could involve jail time. I actually have some friends who've been through this. And then the LMs and CPMs are not legal in every state, but in the states wherein they are legal, they pretty much dominate the home birth and birth center scene because they don't work in hospitals, but certified nurse midwives can. So it tends to be more CNMs in the hospital, more LMs and CPMs in birth centers and at home, with a little bit of crossover CNM into the out-of-hospital scene.
So this kind of brings us to a quandary where you have midwives and it's safer, and then on the other side you have hospital births, and you have this insurance where they won't cover midwives, or they say they do, but they give you a heck of a hard time. And why is it so hard? I mean, it's cheaper for a midwife and more expensive for a hospital.
Yeah.
But why is there this quandary between the two where insurance doesn't want to cover midwives, even though they're cheaper and safer? And it's all
Laura, that's one of the questions someone has already said. We'd really like to wait to the end for all the questions. And for those that don't know, we put the @ symbol. Put @ Robert Breaker or @ Laura Beth or @ Jessica, and that way we can see your question. But I wanted to go there, and I wanted to go somewhere else too. Laura, you're doing great.
Okay.
But as far as cost, okay, $20,000 to go to hospital and have a baby, and midwife, birthing center, $3,000, $4,000, $5,000 for all of our kids. What do we do? Like $6,000, $7,000 for all of our kids so far, or less than that. Was $1,500 for one?
Like two
all together. It was. Was it two or three for the other? So we would be like still $60,000 in debt if we had gone to the hospital and had our children there. So we studied on this. We looked at this. This wasn't just we're just, old fuddy-duddy, silly people that don't know anything. We've looked at this, and we want the best care at the best price. And like you said, Laura, the insurance companies, they give you the worst care, and then they charge you out the yin yang. So, you were going in that direction. This is where I kind of wanted you to get. You don't get the best care often when you go to the hospital. First of all, they give you injections, and oftentimes the injections or the medicine they give you raises the heartbeat of the child. And the whole time they're trying to listen to the child's heart. Oh, and they freak out. Oh, his heartbeat went up. And if you'd not given that medicine to the woman, that hadn't happened. And a lot of times that leads to, the cutting open, the cesarean. Then a lot of times they're impatient. That leads to an episiotomy rather than waiting. And watching Laura go 4 times through this, I was just in awe how God made the human body and how when it's ready, God makes it work. And just seeing Laura go through it and just go, wow, she knows her body and knows, okay, when it's time to push, you push. And that was incredible. Seeing born is one of the most amazing things. But also the way that they make you have a baby in the hospital. They lay you down on your back. And that's one of the most unnatural things. We just read a few minutes ago, Exodus 1:16 talked about the stools and how they gave birth on stools. And the guy that,
answer that.
Yeah, the guy that got us into this showed us about that. He said his wife used to stand up and kind of kneel and hold on to something, and gravity is supposed to work, not laying on your back and trying to push something out. And I've seen the stool; it's kind of like a horse shape, so it's kind of neat to see that.
I'll be right back. I've got one.
Oh, okay. She's going to show us. She's going to show us one of the stools, a midwife stool. And
I was going to ask her what the question. When did that whole laying down thing start? Wasn't that?
Yeah, it had something to do with one of the kings of England or something, right? Or maybe she knows that story. I want to hear that too. And what is that called?
I thought it was King Henry VIII, but
it might have been. But is that some name they call it that you have to lay down, or am I thinking there's no certain name for that? Is there?
It's a horseshoe.
Here we go.
So this is the stool you sit on. There's handles to hold on to and grip. It's low to the ground, so it mimics a squat.
Right.
But it's supported.
And it just makes sense. Gravity helps the baby come out.
Jessica, that seems very inconvenient for you as the midwife.
You have to get down and crouch.
Yeah.
Yeah. I don't think I've ever seen a doctor get that low.
Oh, I train him too, man. I make him get right down there.
So, Jessica, where does that come from? The laying down? Do you know that story? Was it some king or something?
It was Louis the 14th.
Yeah,
he liked seeing his mistresses deliver, and he couldn't do it if they were crouching or kneeling or being on their side. It was inconvenient. And then also right around that same era, And they think it was probably having to do with the preferences of the king at that time. The OBs of the day in France started doing the same thing, just following suit. And they actually were very vocal about the fact that it was for convenience.
For them. Convenient for them.
Right. But the terrible thing is, like Rob said, and I mean, he's a dude, so he hasn't even done it, but he knows that's not natural.
Right.
It's when you think about it, when you're laying, your baby has this narrow area to navigate. Your tailbone on the bottom side and your pubic bone on the top side. When you're laying on your back, your tailbone is pressing up, narrowing that outlet that the baby has to go through. Whereas if you're squatting, your pelvis is nice and open. If you're on your hands and knees, there's no pressure on your tailbone. Even if you're on your side, there's no pressure on your tailbone. But on your back, that is pretty much not only, it's the worst logistically, and it's just...
It flattens the baby's head out too, doesn't it? It kind of flattens the baby's head out a little too much and things like that.
It can cause pressure, which can cause decelerations in the heart rate. Yeah.
So I just mentioned that because it's biblical, a stool. And
or
the way they do it in hospitals now is because some peeping Tom wanted them to do that. And that's just, wow. It just seems like everything in the world just gets away from the Bible so often. And here we are, we're just trying to talk about, let's get back to the Bible way. The stool is the way they did it in the Bible.
Yeah.
Yeah.
Jessica, anybody ever called you a witch?
You. Just like, well, no one's ever called me a witch, but I mean, they definitely...
in jest, witch doctor.
Some people lump us in with, alternative healers and things, as if that's a bad thing, and I know there are people out there who are complete quacks. Everyone knows this. But I mean, anything that is traditional, anything that is natural, tends to get this super side eye from the medical community. I think that's one reason why I love what I do, because I can prescribe medication, and I do with great frequency. But I also know herbs to use. Oh, you're having this problem and you don't want medicine? Try this. It tends to work well. When my
blood pressure was going up with my last pregnancy, what was it you told me?
Well, besides aspirin, there's lemon and baking soda or cream of tartar. That's what it is.
Tell me some teas.
There are nettle tea, because it will flush and cleanse your kidneys. Oat straw that goes along with that. Chlorophyll is great for it, and increasing your protein, which sounds counterintuitive, but it tends to help quite a bit. And believe it or not, increasing salt, but as long as it's a sea salt. Not the iodized type.
Yeah, the book that I was talking about, the Diary of a Country Midwife, the most of the end of that book, like pages after pages, were all the different herbs that a woman should take. And it talked a lot about wild yam. And I don't know if you know anything about wild yam. We've never gotten into wild yam, but it's some sort of something that a woman takes, and it's like a natural birth. What is the thing I'm looking for, Laura? Birth control. And she can't get pregnant, but it cleans her out so that when she goes off of it, she does get pregnant. When she does get pregnant, it's a more healthy pregnancy. So do you subscribe anyone to wild yam, or do you? Because that was a big deal in her book, was wild yam.
So yes, but not solo. I think that it's important to know your body and to know your body's rhythms and cycles, and to track that in conjunction with using other things, knowing your fertility signs and things like that. I mean, unless you're really you don't really care if you have another baby, because it's possible, there's always that element of human error. Sometimes we're not good at taking the things we need to take, or that we're trying to take every day, vitamins, supplements, things like that. You forget, and then you don't get max benefit. So that's why I say, if you're serious about spacing your kiddos or preventing pregnancy for whatever reason, then I think it's a great idea. But I would also use it in combination with knowing your body and your fertility signs. Similarly, Vitex, people who are trying to conceive and have either irregular cycles, or if you're tracking your fertility, then not ovulating at the optimal time. I actually had that issue after I miscarried. My body was just like crazy town. And I used that to get things back on rhythm without having to go to a fertility specialist, you know. So knowing your body's signs and then using a complementary medicine to either prevent conception or to bolster your chance of conception.
So what you're talking about
can I
is
say
that
something real quick, Laura, before I forget?
Okay.
One of the things that you taught us, or you told us, that I thought was so incredible was right about when it's time to give birth, you said, eat a pineapple. And a pineapple somehow induces birth. I thought that was so cool. You want to tell us about that?
Laura, you're about to be mortified.
I just don't know what he's going to say next.
But do you remember that? And do you still stand behind that?
Well, yeah, pineapple has enzymes that can help soften the cervix and get it ready. So that's why
eat it. That, by the way.
Pineapple. Go ahead, Laura. You had a question?
I was just going to say, so what you're talking about here is that there are other options out there other than putting your life into your hands of the doctor and saying, I just give up. I don't want to think about my own body. I don't want to take charge of it myself. Doctor, what do I do? You know, we're talking about taking control of your own. Well, actually, that's the name of my first book. Take control of your own fertility. And thinking about it and taking responsibility for it. I think there's too many people today who don't want to take responsibility for themselves, and they just give their faith. They put their faith in doctors and don't think.
Well, faith in drugs too. They're just like, I don't want the pain here. Just give me an epidural and get it over with. And that can cause a lot of PTSD too. Or no, what is it? Postpartum. I think that's one of the causes is all the chemicals and stuff. But anyway,
and I'm not trying to diss doctors, but drugs come with their own set of problems, don't they?
Side effects.
So, I mean, I have to say, with the exception of a very few, some of the doctors I worked with in the Army weren't the best about counseling, but the group who I work with now, they're really pretty spectacular about doing the right thing as far as informed consent. Also, we have a group who, I don't work with them, but it's all midwives and one doctor. And he says, all I do is C-sections. So he lets his midwives manage everything, and they only call him if needed. So know that they're not, like you said, they're not all bad. I know you're not trying to disparage doctors as a whole and paint with a wide brush, but yes, we are trying to break out of this mold that we've been in for obstetrical care for quite a while. But anytime that you do something, an intervention, a medication, something that isn't naturally occurring, you should have a discussion of risks, benefits, and alternatives. And if you don't talk about those things, then you are not providing informed consent. So anytime that because sometimes there is a reason to intervene. And, I actually printed out here the hallmarks of midwifery care. I won't read them all, but the second from the top is advocacy of non-intervention in normal processes in the absence of complications. That's just under recognition of pregnancy, birth, and menopause as normal physiological processes that are to be respected and allowed to occur and unfold. The very next thing is keeping your hands out of stuff, man. Just stop.
When you say that, every midwife I talk to as an interview, I said, to me, a good midwife would be just stand on the other side of the room and just let me know if anything goes wrong, then you can step in. But just stay over there. I don't need you.
I crochet, man. You got to keep your hands busy doing something. So I crochet.
Yeah. And crochet, right?
There was actually a verse I would like to read about that real quick and screen share this with us, because sometimes bad things do happen. And let me screen share. And in the Bible, we do read about that. In Genesis 35:16 through 19, and they journeyed from Bethel, and there was but a little way to come to Ephrath. And Rachel travailed, and she had hard labor. And it came to pass, when she was in hard labor, that the midwife said unto her, Fear not, thou shalt have this son also. And it came to pass, as her soul was in departing, for she died, that she called his name Benoni, but his father called him Benjamin. And Rachel died, and she literally died in childbirth. And that is recorded in the Bible. And what's interesting to me, you hardly ever hear of that today. if something happens, it's usually the child, but the medical care or whatever is saving the life of the mother. Do you think she bled to death? What do you think was the possible problem there? Because I study old things, 1800s. Women are dying all the time having babies. Guys had 3-4 wives because their wives die in childbirth. What was it that killed the women?
I think there were two main causes. I think you're spot on with the bleeding, and especially, in biblical times, women had huge families, and it's very well known that the more babies you have, the greater your risk of bleeding, because the uterus, right after giving birth, this is why, it's important not to have medications on board if at all possible, because you get this surge of hormones after a normal birth that causes your uterus to clamp down on itself, which stops the bleeding. The more babies you have, the more stretched out your uterus is, and the more that effort it takes to get it to clamp down on itself. So you take a woman who's had an entire Israeli tribe, or half of it.
Part of it.
And then, that it could have been that, but it also talked about hard labor. And that's one of those times when interventions can become appropriate when women are experiencing an obstructed labor. And sometimes it's position of the baby. Sometimes it's, size of the baby in relation to the size of the pelvis. And I don't ever say that to imply that anyone's body is not adequate to give birth. But sometimes, I've had a 10-pound, 1-ounce baby. Sometimes they just grow big, and it's, things happen.
Without a C-section. You had him without a C-section.
That is true.
Wow.
And actually, crazy enough, it was my easiest delivery, whatever that means. I don't know. But anyway, I think that now we have things that we can do. There are medications that we give sometimes to help a mother's body relax and her uterus relax in cases when she's been in labor for days. Sometimes her body simply needs a break to stop, regenerate, refresh itself. She can eat, she can sleep, and then that medicine wears off and she goes right back into labor again, but she's had that chance to revitalize herself. And then also we have things, of course, C-section, the abdominal delivery, but we also have forceps and vacuums, which we really reserve for those rare cases where they're necessary. But if the baby is low enough down to where all it needs is a little extra help, but, either she's too tired or the baby's heart rate is almost non-existent, and we're like, okay, it would take more time to go back for a C-section than it would be to just pull this kid out, then we have that. I don't necessarily think an obstructed delivery was the case in this because she had the baby. Kiddo didn't get stuck, so she proceeded to deliver. But yeah, you're right. I think it's a little over 40% for the cause of death. Just a couple hundred years ago, over 40% was death in childbirth.
Wow, that's the mother that died? Are you saying 40% of the mother? Say that again? For
the women who died about 200 years ago, 40% was due to childbirth-related causes.
Okay, so what would the statistics be today? Do you have any idea of how many women actually die giving birth? Because it's almost practically non-existent, right?
You're right. There are some things that happen, and actually I wonder if that happened to Rachel, but there are things that happen like amniotic fluid embolism. Even when that happens in the hospital, women die. Not 100% of the time. We've started to discover what helps that. I know right now our group has a lady in the intensive care unit who may or may not live as a result of an infection.
That actually brings me to one of my questions, Jessica. I have here that I'm going to interrupt you. Ina Mae Gaskin says that there are many C-section related deaths going on in the U.S. And they're just not being reported as a complication of a C-section. They're being reported as something else. So do you think that the statistics for hospital births being better than they are actually worse than they are?
Yeah, I think so.
Reported?
And by default, it's hospital births because we're thinking cesarean section, and that's the only place these are performed. But anytime that you have surgery of any type, Infection is a risk. Blood clots are a risk.
Mhm.
And usually what we see that kills women after having had a baby, it can be vaginal delivery too, but with C-section is blood clots. They'll have a blood clot in their lung that kills them, or they'll have a blood clot that travels to their brain and they have a massive stroke. So these things do happen. But the reporting, if it doesn't happen within, I believe, don't quote me on it, but I believe it's 2 weeks. If it doesn't happen within 2 weeks of delivery, then it's counted as being blamed for something else, even though the risk of blood clot goes on for several weeks after delivery, for vaginal or C-section delivery. They blame it on other things.
Okay, this is a good question for my last question, so Laura can ask more. But let me screen share this verse, because this is the last verse that I had on this. And this is actually the opposite spectrum. We just saw a case in the Bible where a woman actually died giving birth. Well, here is 1 Timothy 2:15. And I would love to get your take, Jessica, on what this means, because we guys, we don't know. But it's talking about a woman, and a woman that's, obedient to her husband, obedient to the Bible, obedient to God. Paul says, notwithstanding, she shall be saved in childbearing if they continue in faith and charity and holiness with sobriety. My thought on this was always she'll be safe from pain. She won't have as hurtful, like God will keep her from hurting so much because she's an obedient, good, godly woman. But I have no idea. I thought this was a question that I should ask someone that's a midwife. Maybe she can give me some insight in that verse. So what do you think that verse means?
So I'm sitting here thinking, I must not be an obedient, good God to have a baby.
Okay.
I would like to think that I am, at least most of the time. But no.
A guy would think of that, wouldn't he?
I actually have a theory about pain in childbirth, but that's probably another conversation for another time. This particular verse, to me, that bears in mind safety, because it was such a scary and risky thing. She'll literally be saved, not die. That's how I read that, because it was a very dangerous thing in the old times, even up till somewhat recently.
Physical salvation, because she's, a Christian, that God would have mercy on her. Is that what you're saying? Mm-hmm. Okay.
Yeah, that's what I think. But I do think that childbirth before the fall, if there was childbirth before the fall, it was not meant to be as painful as it is. I think that that's made clear in Genesis. I also think female fertility was very different. I don't think it was possible to get pregnant as often.
Every month.
Yeah, I think we were more like other mammals, where they're only a couple of times a year, because that's part of our curse, ladies. Yay, go Eve! It says that our sorrow and conception is increased. So to me, that means pain and frequency with which we can have children.
Yeah, the girls just saw a cat just the other day giving birth, and they came back and said, "Daddy, they're eating the baby." It's like, no. And so that leads to another question. What do you think about eating the placenta? That's what naturally animals do. We don't do that, do we, Laura? But what do you think about that?
No.
So I figure if you want to do it, go for it. I am not one of those who
some do.
It's true. I am readily able to provide resources for placental encapsulation if that's what you want to do. I'm there to support.
No, forget it. I heard of someone grilling it. Feeding it up to the whole family.
That's gross.
That was blending up in a smoothie.
A1 sauce on it.
No, don't do it. Don't do it, people. But okay, so people do it now because there is information going around suggesting that it helps prevent postpartum depression. So what I most often see is women who have already had a baby and suffered from pretty significant postpartum depression, and they're really reaching for straws and saying, you know what, if I can do anything to prevent that from ever happening again, I'll do it. And if that means eating my placenta in pill form or in a smoothie or in a stew, by golly, that's what I'm going to do.
We did actually end up freezing ours for a year in case something horrible happened.
For the blood,
there's nutrients.
Right.
Like you said, we'd reach for that straw if something horrible happened.
Right. Yeah.
But we got rid of it after a year. I think we buried it.
Yeah. My was always asked me, so are you keeping your placenta? And I said, nope, throw that sucker away, please. Get it out. It has served its purpose in my world. So,
okay.
Well, real quick, Laura, one more question, and then I'll let you go. I got to go pee, so you can have this for a few minutes. But the postpartum depression, you brought that up. And you go to the doctor, you get the baby, the nurse takes it and goes to some other room, and the woman's just had her baby and she doesn't see it. Now, I don't know, but my theory is that might be one of the causing factors of postpartum. The baby's born, she should be holding that baby, and that's when the bonding takes place. And the fact that they took it away, there goes a lot of the bonding. There's where your depression comes in. And I don't like doctors doing that. I think that's horrible.
And in fact, there's a trending away from that because I think, it's really funny. You want to know something funny?
I want to know something funny.
Doctors are doing now what midwives have been doing for just ever.
It's becoming trendy, isn't it?
Yeah. So ACOG, which is the American College of Obstetrics and Gynecology, they're the governing body for your medical doctor obstetricians. They come out with different things, their position papers or their the committee opinions, practice bulletins, things like that. And so they actually had one. I lie not. It came out. It's like probably the beginning of 2018 about how informed consent should be done. And I'm like, really?
Totally.
But anyway, as far as the baby being taken away, I'm really blessed to have worked in 2 hospitals, the Army hospital where I was and the one where I am now, where we observe what is called the golden hour. It's been proven that first hour is critical when it comes to bonding, when it comes to moms bonding hormones, love hormones, babies as far as their blood sugar regulation and their heat regulation, and establishing of breastfeeding. So as long as baby is breathing and screaming and pinking up, I deliver a baby right onto mom's abdomen. We wait several minutes. Dad will cut the cord, and then she gets tucked into mom's gown like a little kangaroo pouch and stays there for at least an hour. And we get breastfeeding going and help her out. But yeah, the governing body for pediatrics and neonatal care has come out with that, saying, hey, look, docs, you need to quit swiping babies. And of course, if baby's not breathing or is really struggling with transition, well, then we have a warmer in the room right beside the bed, to where we can say, Mama, we need to take baby over for a quick second. And usually it's just something as, babies have all this liquid in their lungs that they have to expel. So sometimes if we just gently suction a little bit out, or if we...
You don't spank them anymore?
We don't spank them. We don't hold them upside down.
Oh, you don't do that?
None of that. Or if we just... We have an oxygen mask that doesn't deliver like constant flow of air. It's little puffs. So it'll, if we do that puff of air, that sometimes startles baby to want to breathe now. And then as soon as kiddo is pinking and crying, back to mom. But she is always within eye shot, like 100% of time. Even if a full resuscitation is needed, baby is right beside her. So there's thankfully a trend in a positive direction as far as that goes.
That's good. I remember my mom would tell me stories about how she was in an Army hospital. And this is back in the late 70s. They would not let my dad in the room with her. Yeah.
I know. There was actually, I was reading something not too long ago about a dad who was actually fined because, and this was back in like the Louis XIV era, his wife was in labor and he like peeked around the corner because he was worried about her, and he was penalized. He was fined.
Oh my goodness.
And, so yes,
that's crazy. Actually, in Honduras, where we had our first baby, I said to them, I said, look, Robert is going to be with me the entire time. He has to stay with me. We don't separate. And they just looked at us like we had 3 eyes. It would. Fortunately, we were there at a time when there wasn't a lot of other people, so he was able to come into the room with me. But they thought we were the weirdest. So it's still like that. A lot of people follow the states, but are about 20 or 30 years behind.
Yeah.
And Honduras is one of those. So we are super all over the place here, but let me get a couple questions in. This is I've actually wanted to ask you this for a while now. Do you ever listen to people's stories and they say something like, oh, I'm so glad I had a hospital birth because XYZ happened to me, and if I had a home birth, baby would have died, I would have died. And do you ever say anything? Because I hear these stories and I say to myself, Lord, don't let me say anything to offend them.
Well, no. So it's all about tact and discretion.
Certainly.
So, I'll say, oh my gosh, really? What happened? And then they say, oh, the cord was wrapped around the baby's neck. And I say, oh, really? Was the baby like, okay? Did it scream and cry in the delivery room? And yeah, baby was fine because I got my C-section. And I said, well, actually, about a third of babies are born with the cord around their neck, and we just slip it right over baby's head. You never even know that it happened, or if it's really tight, and sometimes it is, we do what's called a somersault. We hold baby's head right up next to your thigh, have you push, and bloop, the body just flips right out, and then untangle and right up on your belly. So I say, but for extremely rare circumstances, a cord around the neck is not an emergency. Or they'll say, well, thank God that I was in the hospital because I needed an emergency C-section. I'm like, an emergency? Oh my goodness, what happened? And they say,
you're so tactful.
Right, I know. Because I'll tell you what's an emergency. An emergency is when we can't find the baby's heart rate at all. Yeah. Or, a baby's heart rate in labor should be between like 110 and 160 beats per minute, with some dips acceptable, but usually it stays within that frame. When it's like 50 and not coming back up again for like, we're talking minutes, 6-7 minutes, that's when we're like, okay, baby's getting oxygen deprived now. This is an emergency. A cord prolapse, your water breaks, umbilical cord comes out ahead of baby's head, and then baby's head lands squarely on it and squishes it between your body and baby's head. That's an emergency, people. There are very few obstetric emergencies. So they say, I had an emergency C-section. Oh, what happened? What happened? And she says, well, I was in labor, and then I wasn't contracting as much. And so then they gave me Pitocin, and I was on Pitocin for like 10 hours, and I never made it past 6 centimeters. I said, oh, that's not an emergency. That was unplanned. That was definitely an unplanned C-section. Obviously, you were planning on a vaginal delivery, but an emergency, that was not. So then I take a moment to teach them about what constitutes an emergency, what is not, and then especially in the case of women who have had C-sections, their options as far as going for a vaginal delivery next time. Because again, this is a positive tide turn that a position paper came out from ACOG in February of this year talking about VBAC, which is vaginal birth after cesarean. It's an abbreviation, talking about VBAC and who should be having them and under what circumstances. It has widely opened parameters. Now, the issue is getting people to follow those guidelines. So the guidelines are out there. It's just now a huge practice change, especially for these docs who have been in practice for, 30, 40 years, getting ready to retire. And they're like, once a C-section, always a C-section. If she has a scar on her uterus, she's not going to have vaginal birth. Not under my watch. Well,
so I feel bad for these doctors where they're stuck between medical normalcy, what's been done, and then medical malpractice on the other end. They're really stuck, aren't they? They can't. They have to do the C-section.
Well,
they don't have to. They don't have to, but there's a lot of them are stuck doing what everybody else does because that's what's done.
That's true. But if someone actually bothered to do true informed consent, then they would have this conversation with the patient. They would document this conversation with the person. And if they said, I don't want a C-section, and it went poorly and something bad happened, they have this documented conversation of, we talked about this. They knew that this was a possibility, and this is what they chose. And that protects you. I know that informed consent can be a huge pain in the tuchus. because it takes time. Because not only do you have to have these conversations, but then you have to document them, because if it's not written down, it never happened. It will not hold up in a court of law. So it takes time, and that's things that docs feel like they don't have. So they skip it and just do the easier thing.
And this is exactly what we're talking about, knowledge. And if you don't have the knowledge, then you don't even know that you're suffering sometimes.
Yeah.
But informed consent and medical freedom. Okay, so this last pregnancy, I had a friend who was also pregnant at the same time, and she was dead set on a hospital birth. But she said to me, "Oh, you're so brave that you're doing a home birth. You're just so brave." And really, I just said, "No, thanks, I'm really not." But really, I actually kind of took that as a backhanded remark of, "Oh, you are so crazy."
You're so reckless.
Yes, reckless. And what the heck are you doing? But really, she wasn't informed. And I feel like what we talked about before, people are just giving their faith in the hands of these doctors, and they don't know. So that's what we're talking about today. There are options.
There definitely are.
Yep. The Bible says to study, and that's what we're trying to do, is help you study this out. Go ahead,
So
Jessica.
my brother actually asked me. I said, "Well, we plan to do this interview with Jessica," and Michael being a few years younger, and he's never been in this situation, and he never thought about it. And I said, "Well, what do you think? What questions should I ask her?" And he said, "What would you do if something goes wrong?"
We have
that's a good question.
So this is one reason why I highly recommend having a trained person present for your deliveries, whether or not you catch your own baby, or your partner catches your baby and your midwife just sits quietly in the corner or not. I think someone trained needs to be there, because stuff does happen. I mean, nothing in life is without risk. You can eat food and choke and die. You can drive down the road and get hit by a Mack truck. Stuff happens. So be prepared. This is why we wear seatbelts and chew our food before we swallow. So the things that we see most are hemorrhage with excessive bleeding, and shoulder dystocia. So a shoulder dystocia is when the baby's head comes out and the body does not. At this point, you have minutes to get the body out before the baby's brain cells start to die.
Can I interrupt for a second? One of my friends, that happened, and his arm, the oxygen to his arm, and his arm was like this the rest of his life because he got stuck and it cut off. Poor guy.
Yeah, that's brachial nerve palsy. So when that happens, you now have a baby whose head is out. When babies' heads come out, they usually, if a woman, just to give you a point of reference, is on her back, then the baby would be looking at the floor. So revise that for any other position that she might be in. So what happens then is, usually right after the head comes, the anterior shoulder, which is the shoulder under the pubic bone. You remember how I was saying you have the tailbone and the pubic bone to navigate through. That one under the pubic bone gets stuck. So here's the pubic bone, and baby's trying to come, and it just doesn't, because that shoulder is hung up. We have a whole series of maneuvers to do. And I've had many shoulder dystocias in my career. My longest one was 4 minutes. I'll tell you, I'm nervous after a minute. 4 minutes, I was like ready to leave the room and vomit when it was all said and done. Baby was fine. Mom was fine. But I was in crisis mode.
But you didn't let her see that, did you?
Oh, of course not. No. And you guys would appreciate this one. She spoke Spanish only. So that I would usually be telling her, okay, you need to do this, you need to do this, you need to do this. I'm like Spanglishing that thing as best as I could. It was kind of a hot mess. But I had a resident with me, and so I let the resident work through like 3 maneuvers because they need to learn. And then I said, "Do you need help?" And she said, "Yes." And I like blink right out of the way, get in there, start doing my maneuvers, and then a couple of minutes later that baby came. But whenever the shoulder is impacted, I think sometimes what may have happened with your friend, the impulse is to pull on the head to try to dislodge that shoulder. And what happens is this nerve gets
Bring him here. Bring him here.
Broken. And then you end up with this, like the waiter sign, like you're looking for money behind your back, where that nerve is then paralyzed for the life of the individual. But doing these maneuvers appropriately, you're not causing nerve to get the baby out. Go ahead.
Right. If you're ever in a situation like you're in an elevator and a woman's about to give birth or something, don't ever pull on the head. That's not. You don't ever pull a baby out. You wait and you catch it. Right? Isn't that the right?
Yes.
Don't go pulling on stuff.
Don't do things. The only time we can pull and gentle traction is sometimes needed, but that's trained hands. We know how much is okay and how much is not okay. They actually have practice on that tell you, like, after the simulation, you applied so much traction, you would have caused a brachial nerve plexus injury, or you applied the right amount. So that's how we learn, like, how much you can work with. But we know these maneuvers. We use these maneuvers. You work through all the maneuvers, and it still didn't work from the beginning. And you just keep going and doing them. And thus far, knock on wood, thank God, please don't let this change, I've never had a baby that I've not been able to get unstuck. And then postpartum hemorrhage is the other one. So we have things that we do, including the things that mom hate most, which is uterine massage, which sounds like it should be nice, but it's really bad. It's a real bummer because it hurts. You just had a baby and we're aggressively rubbing your belly. And then bimanual compression. So that's a hand inside, a hand outside, and squeeze, just like you would hold pressure on a wound. You hold pressure on the uterus. And then there are medications that we give. And with my home birth, at a birth center, the things that they have, the medications, because they do have them, the resuscitation equipment, because they do have it, it's all hidden away, but it's there. When I had my home birth, my midwife had my husband go and get duffel bag after duffel bag out of her car. And so once everything was in, he looks around the living room, he goes, "Deetra, what is all of this?" And she goes, "Oh, that's the pool, that's my birth kit, and that's the contingency plan. So you'll probably see those get opened. If you see any of the other ones get open, then we're having a problem." So we have things, even in the out of hospital setting.
So you don't go to a home birth with shoestrings and towels?
No, flowy skirts and Birkenstocks, although I do wear those. And I actually have a
boiling water, right?
But yes, there's a lot more than a wing and a prayer when it comes to having a baby. And a lot of midwives who I know, especially those who exclusively attend home births, especially like the Amish community, they have an entire herb kit that goes with them, tinctures and, sublingual medication you can tuck under their tongue and things like that for any number of complications that you might see, a labor that's obstructed, a uterus that no longer wants to contract, bleeding, a placenta that's stuck.
I think the point is with a midwife is that you're taking care of her the whole time, and you see signs if something goes wrong, that then it's time to go to a hospital or a doctor, or take care of the problem before it gets to be a problem. And that's the point of a midwife, so you don't get to those problems.
Exactly. It's that trained eye. Someone gave me a pendant that says a midwife has the eyes of a hawk, the heart of a lion, and the hands of a lady. So it's so much more than just being there. It's keeping a watchful eye for those things that will manifest themselves if you're watching.
I heard Ina May, who is a very famous midwife, if anybody wants to look up her.
So good.
She described it so beautifully. She said being a midwife and taking care of a woman is like walking outside at night by the light of the moon. Your eyes adjust and you can see everything after you let your eyes adjust, and you know what you're looking at. But being a doctor and using all their equipment is like looking through a little pee hole and trying to walk, or it's trying to walk by a flashlight. So you can only see like a little section at a time, and you don't know if there's a bear over there or whatever. Right. And I thought that was just a beautiful example that midwives are trained and they know what to look for and they see a bigger picture.
Yeah. And they're there to see it. And I think that's probably the bigger thing than, I think external fetal monitoring, the monitors they put on your belly has come under intense scrutiny in the last several years because it's been very common to have a baby who looks awful on the monitor, and then they go back for a C-section and you have a pink and screaming kid and you're like, there was nothing wrong going on in here. So where is our equipment failing us? But I think because of volume, because volume equals money, people rely on monitors instead of their own eyeballs to be there and be present. So they miss those finer points, Yeah. And I think that by being present, even if it's not constantly, because I'll have sometimes 3-4 ladies in labor in the night, and I bounce room to room to room, but I spend time in each room, and I talk to her and what are you feeling and where's your pain and maybe we should try this position or that position and work with her rather than just pop in, okay, baby looks good, oh, look, your cervix is dilating, okay, and then out the door. You have to be present.
Well, we have our first question, it looks like. Someone says, at the midwife, so this is for Jessica, my son was breech rear end first. Did I absolutely have to have a C-section? And what could be done? Do you just push it back in and turn it? What do you do in that case?
That hurt my body just hearing that. Okay. No, so don't push the baby back up. So if a baby is breech, every effort should be made to turn the baby. This would be done before labor. I actually start at the beginning of the 3rd trimester, something you can do through your entire pregnancy, but the beginning of the 3rd trimester, I recommend visiting a website called spinningbabies.com, and it actually shows you how to map your baby to feel for parts and know if your baby is head down, head up, or sideways. And then furthermore, is the baby facing behind or in front? We want the baby facing behind or off to the side for optimal positioning. And then if kiddo is not in the right position, they have stretches and exercises and maneuvers that you can do both on your own or with a helper to encourage your baby into the optimal position. Because sometimes when you get a kiddo who, no one's been checking because, they just listen to heart tones and measure a belly, they don't put hands. There's something called Leopold's maneuvers where you can feel and know what position the baby is in. I do Leopold's on everyone in their 3rd trimester, but some people don't. And then they're like, they go to check a cervix at 39 weeks, and they're like, oh, well, we could have been working on this for weeks had we known. Now this baby is really big and it's less likely to want to turn, But then there's also something that is called an external cephalic version, which is done by the healthcare professional where they actually manually try to turn the baby. Then chiropractic adjustments, moxibustion. There are lots of things you can do on your own. Then if babies stay persistently breech, this one's hard because breech is actually considered a variation of normal. You can have a baby breech vaginally. In fact, we had one accidentally just a few weeks back when someone arrived to the hospital with no prenatal care, completely dilated. And my resident went in to check to see if the patient was ready to push. And she looks at me with this like deer in the headlights look and she goes, well, either she's completely dilated or she's 1 centimeter. And I just stuck my finger in the baby's butt. And I was like, did an ultrasound real fast. So I got an ultrasound, confirmed baby was breech. This kid was coming. So we had a breech baby.
Wow.
And again, butt first. Yep. Feet first is more dangerous than butt first.
Did mama tear?
No, she did not. No. But with breech, that's not, of course, the most thing. It's head entrapment.
My question.
Yeah. So when a baby is born breech, the biggest diameter of the baby is their head. obviously, big old noggin, and it paves the way for everything behind it. When you have a baby come out feet first, God forbid, because that is very dangerous, or butt first, which is not as bad, because if their legs are tucked in front of their face and their booty's coming down, well, that's a pretty big diameter too, and it protects the cord. You know, the legs protect the cord as the baby comes down. But it is not something that is taught. It is taught as an emergency. So we know things to do. Usually hands off is the best thing. You just let the baby come, because the critical moment is when that chin is coming, that the chin stays tucked. And if you're trying to move the baby's body that's hanging out, you could untuck that chin and now you have a stuck head. So usually it's just keep your hands off, let that baby come, which is hard to do. But it's taught as a set of emergency skills. It is not taught as something that you do on the regular. I do have a friend in North Carolina who is a midwife who has for several years now worked with a doctor who routinely does vaginal breech deliveries. He is one of the few in that area who does, and he taught her. So she now routinely does vaginal breech. But so I would say to you, an answer, long-winded answer to your question, sorry about that, is that if you have an untrained provider and you have no chance to get this baby turned because you're actively in labor, your water is broken, whatever, then the safest option is most likely a cesarean. However, if you know your baby is breech, and again, this is where that knowledge deficit piece comes in. If you know your baby is breech, it has been persistent, you can't get this kiddo to turn, you go and you look for doctors who do breech vaginal deliveries on the regular. They're well trained. They do it all the time. This is not an emergency to them. This is just a variation of normal. You find that provider and you can safely have a vaginal breech delivery. So it's all about the planning in this case.
Right. I wanted to ask a question. Well, maybe an observation and then get your point on it. Laura and I, we got pregnant within probably 24 hours of when a friend of ours and his wife got pregnant. And we were actually together that day. So I don't know, it must have been a happy day for all of us or something. But we went to the Pecan Festival or something. But we kind of were joking with them. Oh, we're going to have ours first. No, we're going to have. And so we had our baby 10 days early and we called him up, said, ha ha, we beat you. And he's like, nope, I had mine like 23 hours earlier. And I remember walking out of the birthing center and it was 5 in the morning and looking up and seeing the biggest moon. And here we both had our babies on a full moon. Do you think, because the moons affect the tides of the oceans, and a woman's got water, there's a tide, I guess you could say. Do you think the moon affects birth?
Oh, definitely.
And have you seen that in your practice?
I have. In fact, when I drove in, because I worked the last 2 night shifts, that's why I look a fright and, you know, because
you're beautiful.
Look at my eyebrows. They're awful. Anyway, so anyway, I drove to work 2 nights ago and I was like, oh man, it's a full moon. And sure enough, we had all the crazy happening. Like not the normal, it wasn't just women coming in and having babies. It was like intense situations. So it's not just, I think, more people going into labor. It's more weird stuff that happens. Additionally, it's interesting. We see a surge in blood pressure issues in pregnancy about this time of year because statistically speaking, they don't know why this is. But if you conceive your baby in the summer, you are more likely, almost twice as likely, to develop high blood pressure as opposed to a woman who conceived at some other point. So they're investigating that to see, are there ways that we can prevent it from happening? I don't know. But yes, I think seasons, I think moons, yes, these things are pregnancy, childbirth, cycles, menopause. These are all natural things in a woman's life, and natural things are affected by nature.
Exactly.
Okay, so a lot of people, I think, don't want to have a home birth or birth with a midwife because they are afraid. They're afraid, and they're afraid of pain. I mean, I've talked to people about it and they're just like, I don't want to talk about it. It's just going to happen when it happens. And I don't need to talk or think about it because they're afraid of the pain, Jessica. And I think that's why a lot of people have hospital births, because they want that epidural. I think we talked a little bit about how it comes with risks. Like everything comes with risks, but you don't have to be afraid. And I've read several books that say the fear actually causes the pain
to be worse. Yeah, for sure.
Good point. Yes.
Because think about it, when you have tight muscles, when you're having that fright, fight, or flight reaction, your blood pressure goes up, your heart rate goes up, your muscles tense because you're trying to decide what are you going to do in this horrifying situation. So I think, from the start, and, we've had pretty in-depth conversations about this because of how we've dealt with pain throughout our own labors and births. But I think that, again, preparation is key. And talk about suffering with knowledge deficit. You will actually literally be suffering.
Fear of the unknown is the biggest fear. So if you don't know what it's going to feel like going into it, that there's this huge monster fear behind that, and that's going to cause pain to be worse. But if you know what's going on, if you read a book or two and you know what's going to happen, so much of that is taken away, and you can not, I wouldn't say be pain free, but they're
less pain.
90% of it gone.
Yeah, or able to tolerate things better because, it's, again, part of the woman's side of the curse, our sorrow and our conception. I think that, if you see a mammal giving birth, a deer, a dog, they're obviously not their normal selves, but nor are they laying on their backs howling in pain. So I think that our births would be more like that had it not been for the fall. But you think about all the things that had to do with the fall and the change in the relationship between God and man, the change in relationship between humankind, between themselves. Now they're having to fend for themselves. Right. And then, having to work harder in this sin-cursed world. And there was this massive change. And I'm sure fear was a big part of this. And no one likes to hurt. Like, I don't know many people who look forward to pain. They're like, oh, yeah, it's going to hurt. Not many people are like that. But if you're pregnant, you're going to have a baby. Historically, this is not a comfortable situation. But there are things that you can do to minimize the discomfort. You can take care of yourself. You can eat well. You can sleep well. You can exercise. You can stretch. You can stay limber, help these joints and, the ligaments and tendons in your pelvis to be able to accommodate your baby by taking care of you. Then it's your mental approach to the pain and accepting it rather than fighting it.
Yeah.
And if you are accepting of it, then you're able to relax, you're able to breathe through it, you don't get out of control, and then by default, it's more tolerable.
Ina May says that a lot of it has to do right here in the jaw, where if you're relaxed in the jaw, let me go the opposite way. If you're tense, you tense up in the jaw first. And if you're relaxed, it's directly related to your uterus and it will relax, and you're so less likely to tear, literally, if your jaw is relaxed. And she has a lot of videos about laughing and kissing and all this other stuff that helps. Anyway, my point is that it doesn't have to be as painful as they make it out to be in the movies and the shows and ER.
Oh. Honey, please, all I ask is that you don't start talking about orgasmic births, okay? Please. I watched too many YouTube videos with you on that, and that's something I don't want to go to.
I saw the show. It's called that. I won't say it again.
I can't say that I've ever seen anyone accomplish that except on YouTube videos. But anyway,
and weirdo Australian people. They seem to be all from Australia. That was weird.
But,
and you know what else? Australian men breastfeeding. That to me was the weirdest thing. But anyway, go ahead.
Pretty close to pain-free.
What is pretty close to pain-free?
I've seen YouTube videos where they're pretty close to pain-free.
Yeah. And there was actually, I think, through my different births, I had varying levels of success at varying times in the process with managing the pain. But I remember distinctly with my 10-pound plus baby, there was a point in time where I was in the tub and I was just focused on everything, and I was just relaxing and breathing. And it was not a comfortable thing, but I was managing it and tolerating it and breathing through it. And my ears were underwater, but I heard my husband ask my midwife, "Is she asleep?" And then she actually said, "You know what? Sometimes women have a break during labor and their contractions stop and they sleep." And then I'm just sitting here floating and I go, "I'm not asleep. I'm still having contractions."
With Elise, I did sleep, and I slept through a couple contractions, like kind of halfway awake asleep. Like you can sort of hear what's going on, but I was asleep through the contractions.
Lady. I've never been able to sleep, but I've been able to relax to the point where it was nothing like it was when I was a little more out of control. Because there were those moments too. Yeah. But, I think a lot of it too is cultural. We see there's a huge Hispanic population in my area. A lot of women from Guatemala, especially, and they're these tiny little 4-foot tall ladies. Mm-hmm. They push out a baby silently like nobody's business. And that's just the expectation. Like, they don't expect it to be any different. They don't expect it to be like we expect childbirth in America to be, this like horrible event. And so they just do it. They just come in and they just have a baby. Yeah.
Yep.
Just breathe it out. You go, Mama.
How many more questions? Yeah, Laura, how many more questions? And then we can do, if they have any questions. Go ahead. What is it?
Well, it's kind of like an end question. For anyone that's pregnant, thinking about becoming pregnant, or really, like we talked about, just wanting to manage their own birth control, what books, websites, DVDs, what do you recommend?
There are a lot out there. I think you already mentioned taking charge of your fertility as far as the, learning your body's cycles and rhythms outside of pregnancy. As far as books, if you want just a very sort of basic introduction to the different ways that you might give birth, believe it or not, Ricky Lake, Ricky Lake has gotten very much into the birth community.
Yes, I forgot. I wanted to mention that one too. It's called The Business of Being Born. We've given that away to people. It's
your best.
You made another? I didn't know that, but that's very, very good. If you want to learn about and you're thinking about and you're like, I don't know if I could do that. That is an excellent. And she's a secular woman, but that is an excellent video. The Business of Being Born.
Then she has a book called Your Best Birth, and she goes on to talk about the different types of healthcare providers, the different locations where you might give birth, the different options that you have. But it's not medical counseling. It's Ricky Lake's books, but it gives you a great jumping off point, and it gives you some food for thought as far as which direction you'd like to go into. There's also a book called The Thinking Woman's Guide to a Better Birth. It's by Hensie Goer, and it's an oldie but a goodie. I definitely recommend that one. All of Ina May's books. Now, for those of you who tend more towards the less hippie side of life, you may be slightly off-put by some of Ina May's stuff, because she does get into some of the more spiritual aspects, not necessarily in the Christianity type viewpoint, but the spiritual aspects of childbirth and herbalism and things like that. But that Ina May has written Spiritual Midwifery, Ina May's Guide to Childbirth, and Birth Matters. And Birth Matters is one that hits more, statistically, where are we going? Where have we been? That type of thing. So if you're looking for more information without like a guidebook on how to have a natural birth, Birth Matters would be a great place to start. And then if you're a statistics hound like I am, Jennifer Block wrote a book called Pushed.
I was going to say that one.
Yep, that is a really good one to, again, where have we come from? Where are we going, and why? If you have had a C-section and you're considering a VBAC, go to the ICAN website, the International Cesarean Awareness Network. They give you all kinds of evidence-based information, practice bulletins, just really everything you need to either A, just make that decision for yourself, like, I am a good candidate, this is what I want to do, or B, if you choose to see a midwife or obstetrician, have a hospital birth, what questions to ask and how to get that conversation started early. Because some people, I have had women who want a VBAC and their doctor's like, oh yeah, sure. And then they get to 36 weeks and they say, okay, we need to schedule your C-section. She said, but you said I could have a vaginal delivery. And they said, no, we've decided not to, blah, blah, blah. You need to have this conversation early and often when it comes to planning. And then as just another sort of childbirth resource period, Childbirth Connection is a good website with lots of information on it. I would stay away from all of the, whatchamacallit? What are those ones that irritate me? What to expect when you're expecting. What to expect.
Oh, brother.
These are
yeah.
The Mayo Clinic
never get anyone these books for their baby shower. I will hurt you through the computer. Just don't do it.
There, every garage sale we go to, that book is on the table. What to expect when you're expecting. It's
every
printed. Yes. Well, I wanted to read a verse before we get done. Let me do that real quick, Laura. Did you have any more questions while I'm looking?
No, that was actually, I think I covered everything.
One person comments and says, well, there's no Bible verses here. Well, we've already given a lot of Bible verses, and I'm going to give you 2 more real quick here. But it is amazing. It is amazing. This is a verse that I like. Psalm 139:14. I will praise thee, for I am fearfully and wonderfully made. Marvelous are thy works, and that my soul knoweth right well. Yes, God made us, and boy, are we made in an amazing way. But the verse right before it, for thou hast possessed my reins, thou hast covered me in my mother's womb. And that's what we're talking about today, is birth and being in the mother's womb. But we definitely are fearfully and wonderfully made. I made the comment about men breastfeeding, and you think about that. I mean, that's pretty interesting that men can actually breastfeed, and they can, and we can produce milk. Why would that be? Well, God in his infinite knowledge would have known what happens if the wife dies, and they're alone. Well, the man could, raise the child or something. I don't know, but it's incredible when you study the human body and see what man can do and women can do, and women can do a lot more than men. I would not want to give birth. Let me just say that right there. I remember, was it Carol Burnett talking about giving birth? And she said, if you're a man, you want to know what it feels like, take your bottom lip and just pull it over the top of your head. And that's about a little bit of what it feels like. It must be painful. And so I don't want to know. But I do know I shared Laura's pain, the first one, as she grabbed my shoulder. And for several weeks after, I had some bruises. I could feel the pain a little bit. But it's amazing how God made us. It just is so incredible. And to be a witness and to see a birth, it makes you a believer that there is a God. I do not believe in evolution. God designed these bodies the way he did to do things that we do, and it's incredible. It's incredible.
Indeed. So, well, I have one more question for you, Jessica. I don't think we've ever talked about this before, but have you ever heard about the Salem witch trials and how it was actually started out as trying to get rid of the midwives?
Going after midwives. Yeah, I actually have. And there, depends on which source you go to that they say that that's historically supported or not. When you think about, a midwife, okay? Y'all might be a little offended. Don't be offended, but it's true. My life revolves around sex. It just does, and that is still a slightly taboo subject. So then think about the Middle Ages. Think about the time of the Salem witch trials. You talk about anything having to do with a relationship between a man and a woman, that's like big no-no. Okay, so not only are we addressing, sexuality, but we are, giving things, plants, herbs, supplements, suggestions to improve or change your health. And that could have been viewed as magical powers or spells or, potions and things like that. Right, exactly. So between the idea of having a gathering of women who support each other when it comes to female health, fertility, and sexuality, and then throw some herbs in there, you've just got, witches circling a cauldron. And who thinks that's a great idea, and then you have the whole issue of, the threat to the medical community. When you have, it used to be that midwives were the way to go, and then it shifted over to obstetricians and hospital settings, the last 200 to 400 years, really, there was that big push.
I see it from like a kind of spiritual stance. This is the devil saying, let's get rid of this good stuff and bring in hospitals to separate families. And I see it, getting rid of this ancient knowledge is part of getting away from God.
Yeah, I agree.
And let me say too that Jessica is married. It's an honorable sex that she was talking about with her husband, and that's what we believe as
I think
Christians.
what she was talking about was when she deals with her.
Yes.
Okay, but we're getting some comments, and they were like, "Is she married? Are you?" Yes, she's married. She's married to one of my best friends who went to Bible school with me. But the Puritans also were the ones that did that, and the Puritans believed that sex was sin, unless it was to produce a baby. So the Puritans were saved, probably Christians, but they were fuddy-duddies. I mean, the Bible says marriage is honorable and all, and the bed undefiled. You can make whoopee when you're married and you're saved and enjoy it. It's not sin. But the Puritans looked at it as it was. So you look at that mindset, no wonder, they're witches and things like that. So anyway, sorry. Go ahead, Laura. Give a little historical context there.
I don't think you can wait another minute.
Okay. Well, if anyone has any questions, now would be the time to ask them, and we'll try to see. It looks like haven't been too many questions.
Well, I saw a couple as they've come. I did see someone ask about VBAC after twins.
Okay.
If you have had a cesarean simply because you had twins, then you are actually an excellent candidate for a vaginal delivery for your next birth, because there was nothing to suggest that you can't get a baby through your pelvis. They just did it because there were twins. Also, the vaginal twin delivery, just because you have twins doesn't mean you have to have a C-section. And as long as that first baby is head down, it doesn't matter if the second baby is breech or sideways. They usually turn after that first baby is born. So you can have twins vaginally as long as the first baby is head down very safely. And with a midwife, we've done that in the hospital. I've done that in the hospital. But a doctor these days uses what they call a VBAC success calculator. So they look at the circumstances surrounding your C-section. And if it was just for like twins or malpresentation, you have like a 85 to 90% chance of success. If it was for the type of thing where you got to 10 centimeters and pushed for 6 hours, you have less of a chance of success, according to them, because that would suggest that maybe pelvises are different. They do expand in labor, they expand in childbirth, but sometimes people have very narrow pelvises for whatever reason, and they have very great difficulty in birth. So in those cases, they may say, yes, go ahead, we'll try for VBAC, but just know that your odds are less than some other women. But if you want to proceed, then you should be able to proceed. There's another question about abortion, which I think is a long conversation for another time, but I think it's awful. I think it's vile and disgusting. And my husband and I have had multiple conversations about this recently with all the news coming out. You can so much to say on it, but
it's easy to see who's saying it, and I know Republicans and Democrats are the same thing in the same coin, but it's the Democrats really who hate midwifery. Sorry, he's distracting me. They hate midwifery. Say it's not safe. Oh, we can't let you have a midwife. It's not safe. But at the other side of their mouth, they'll say, "Oh, go ahead, have an abortion." And so I don't really see it as anything. It's not about safety of the mother or the child. It's about control, and it's about you can have whatever you want as long as you have what we want.
Right.
And
yeah. And what kills me is if you talk to an obstetrician, you will never hear one say there is a medical reason to kill a baby and then remove it from its mother's body. Now, I have seen women come in exceptionally sick. I mean, seizing because of eclampsia. And they are 24 weeks, 25 weeks, right at the border of viability.
Yeah.
But what do? We do a C-section, and then we send the baby to the NICU, and we try our best to keep that kiddo alive while curing the mom of her pregnancy, which was trying to kill her. You know, you don't kill the baby first and then take it out. In fact, that is more risky. You have greater chance of malpresentation, greater chance of bleeding. It is more risky for the mother. So this whole thing of, you know, oh, it sounds great if you don't dig into it, of like, you know, if it's between life and death for the mother, then, you know, termination of pregnancy. What if she has other babies at home to take care of? Isn't, you know, the loss of, is what's worse, the loss of the life of the baby or the loss of the life of the mother? You don't have to kill the baby. You can terminate a pregnancy without killing a child. It is called induction.
Mm-hmm.
You can have a baby, and then if you don't want it, you can put it up for adoption. There is
what is induction? Explain induction. I've never heard of that.
Induction is where your labor gets started for you. So if you are not in labor,
yeah, okay.
Yeah, if you're not in labor and you need to be, we have medicine to make that happen.
But we know
that's what they did to Laura the first time. Okay, yeah.
Right.
It's a spiritual thing.
Right. Mm-hmm. And that's what
we know this. I mean, we can fight it till we're blue in the face, but we know which way it's headed. So
things get worse before they get better, and this is what we can expect as Christians towards the end time. And
not to say we shouldn't fight it.
Right, for sure. And I'm vocal about it.
It's a spiritual battle.
But yeah, I think it's a horrible thing what's happening. And I think when we talk about education and pregnancy and choices and childbearing, that's not what I'm talking about.
How medical, it is my body. Let me have my baby at home.
Right. There you go.
Okay, there's a question about PCOS. I don't know what PCOS is. Do you know what they're talking about?
Yes. What was the question?
Okay. Could you talk? Let me make sure I read it here, but I think it was, can you talk about PCOS? So I have no idea. I've never heard of PCOS.
So PCOS is polycystic ovarian syndrome, and it's caused by hormonal issues in the mother and manifests as that. A lot of women who have PCOS have a very, very hard time conceiving. Usually, so what happens is your body cycles through ripening eggs and releasing them. And those eggs form in follicles that are basically little cysts that then burst and release the egg. And this happens in a very sequential type of manner. So you're constantly brewing up an egg and then releasing one every cycle. 2, if your body is one of those bodies who likes making twins. But with PCOS, you have like a ton of follicles trying to mature at the same time and in varying stages of maturity, to where the ovaries just look like grapes, just like there's cysts all over the ovaries. Insulin resistance has been heavily linked with PCOS, so basically diabetes and also thyroid issues. So if you have PCOS, if you've been diagnosed with it, then what you're going to want to work at is hormone balancing, lowering your blood sugar, and balancing your thyroid. So there are a number of ways you can do that. You can look it up. There are many sources available online as far as things that you can do for your thyroid, iodine, different supplements that you can take. Usually insulin resistance is improved with weight loss and exercise, which, I mean, I'm a fluffy chick. Yeah, I don't like hearing that either, but it's true. And by cutting back on sugars and white flours and basically things that spike your blood sugar. And then as far as balancing your fertility hormones, I have found Vitex, which is also known as chaste berry or chaste tree berry, to be really excellent in balancing female hormones. It's taken as a tincture most effectively. I know it's available like in pill form for dried herbs as well, but I prefer the tincture. I feel that it works better. and more expeditiously. It's something that you usually have to take for several months before you start seeing things regulate. But over the course of those months, you start seeing things coming into balance. So thyroid, blood sugar, female hormones. Yeah, PCOS.
Okay, another question. Well, it's not really a question. It's a guy commenting, and since this is more for women, let's he says, I had morning sickness with my wife every time. Isn't that called sympathy pains? And is there really something to that, or is that?
Anecdotally, yes. I don't think there's anything scientifically to support it, but yeah, my husband was the same way. He got, especially my daughter. I was super sick with my daughter. And he lost a lot of weight. Poor guy. He was legitimately like ill, like poor appetite and nausea, vomited a few times. And I'm like, I'm sorry, but I don't know what causes that. But yes, I think that it is a thing.
Yeah. Interesting.
And I know that I've seen too a lot of things kind of scrolling along the side about, yes, I know this is not like as much of a Bible-centric conversation as you're probably used to with Rob. But it's important. I mean, even if you're a man, even if you're not married, even if you don't have a wife, even if you're not planning on starting family, I'll bet you have a sister. I'll bet you have friends who are married and who are in the childbearing phase. And Rob has quoted or read off many scriptures having to do with conception, childbearing, midwifery, the things that all surround childbirth. They're important. This is our next generation. And, it's kind of hokey, but there's a poster put out by one of the midwifery organizations, and it says, peace on earth begins with birth. Now, I know that there will be no peace on earth until, I'm there with that. But you think about it. Birth is the very first, like, being carried in the womb and being born. Your kids are not going to remember this, but it's the beginning of their formation. It is pivotal. It is foundational. If you're going to do this, do it right. Don't be careless. Don't be cavalier. Take care of yourself, plan things, do what's best for you, do what's best for your baby, educate yourself. And if you don't care about it because you're a guy who's not married and not having kids, pass this information on. You'll hear women talking about, at some family gathering, oh, so-and-so had their baby. Oh, how did it go? Oh, well, she went to the hospital. She ended up having a C-section. Well, guess what? Jump in. So you know what? I just heard this thing, the web, YouTube live, web chat, whatever. And a midwife was talking, and she was saying that there were a lot of options, even if you've had a C-section, or a lot of options for providers and hospitals. Have you guys heard about that? And get that conversation started. Even if you don't participate in it, throw that fuel into the fire and see if you can spark a discussion amongst these women.
Right. Exactly. I don't know how I could have put it any better. That's exactly right. And we did try to tie this into the Bible because the Bible says not to fornicate. It says flee fornication. If someone's out fornicating, living in the world, imagine how many diseases they could get. And then they straighten their life up and they want to get married and have kids. How often have you seen someone living that kind of a wicked lifestyle and it affects the child? That's a horrible thing. The child has to live with the sin of the parents. Have you seen anything like that?
Oh my gosh, always. We have, anything from sexually transmitted infection to addiction. Where babies have to spend weeks in the neonatal intensive care unit because of what they call neonatal abstinence syndrome, which is a fancy word for this baby's withdrawing from cocaine, for weeks. Wow. And that's how it spends the first weeks of its life. And then it may or may not have developmental delay and things like that, depending on the extent of it. Things like syphilis. There are things that can kill babies in utero. Gonorrhea, chlamydia can blind them as they're being born. Yeah, the things that we do have a huge impact on our babies. We're not just a gestational carrier. We're so much more than that.
Right. Laura, do you have anything to say? You're on mute if you want to take mute off and answer. Because I don't see any more questions, so we might want to wrap this thing up. Laura, you want to take it off? You're on mute, honey. Or I can take you off if you.
I have one thing to add, and it was on a list of questions that Lolo included that she might ask. And it was actually her very first one. So I'm surprised she didn't ask it. What? I'm not a real doctor.
Oh, yeah.
And I would say, I'm not a doctor at all, nor do I choose to be. It's not that I'm trying to be one or I'm half of a doctor, but I choose not to be. Because as, my training as a nurse taught me, it's all about the bedside manner, touching your patients, literally, like hands-on, touching your patient, talking to your patient, observing your patient. And in this case, I call them, in the hospital, they tend to call them patients. I like to call them clients. They seek out my care, and I sort of hate the words delivery and patient, but by default, since I work in a hospital, there's a lot of that, and I kind of fall into it. But pizzas are delivered, babies are not.
Do you say that you delivered babies, or do you say you aid in the delivery of the baby?
I say I catch babies. When I talk to people informally, I catch them, because usually I do. Usually I ask them, dad or mom, if they want.
I'm not offended, but I did the work. I delivered my babies.
True.
Right?
True.
Yeah.
So I'm not that I'm offended for someone else. It's kind of like saying somebody else married Robert and I. He didn't marry Robert. I married Robert. Robert married me. That he performed the ceremony in which we were married.
Right. So I catch babies. I don't deliver them. I don't push them out. And sometimes I'll say I attend births, because that's what I do.
Okay. How many babies have you caught? I don't know if you've answered that or not, but at one time it was like 100. What are you up to now?
Yeah, several hundred.
700?
700.
Are you going to have a big party?
Several.
Okay, several hundred.
And I know you're gonna flog me verbally for that, but there are some nights, because I don't just keep a tally of numbers. I have a birth log, or I did, that I used to maintain, where I had the age of the mother, complications, APGAR scores of the baby. So how did they do transitioning into life? Any complications? How long were the phases of labor? I mean, it was a true journal. And when sometimes I'm catching or observing a resident doing births 5 and 6 people in one night, I don't have the time to maintain that log. But when I stopped counting, I was a little over 200. And that was a year ago of this rapid pace job that I have right now. So definitely several hundred. And then, interestingly enough, my grandfather is a retired orthopedic surgeon, and most of my aunts are nurses on my dad's side. And of all the people who asked me, why do you want to be a midwife? None of them asked because they knew, because they're in it. And even my grandfather, who's a surgeon, he said, that makes total sense. Why do they have obstetricians taking care of normal, healthy babies? And some people have even used the example of that would be like hiring a pediatrician to be your babysitter.
Mm-hmm.
For something normal and healthy and totally non-eventful, why would you get the highest qualified person? I am not as qualified as an obstetrician. I do not do surgery. I cannot remove a baby from your abdomen if it needs to happen. That's their turf. If you're 25 weeks and preeclamptic, that's their turf, not mine. But when it comes to the normal healthy with few variations, a midwife is what you need, because that is our skill set. That is our scope. That is our practice. So he totally understood. He's like, that is exactly what you should be doing. I'm like, yes, from the mouth of a surgeon. There you go.
Amen. Well, how about this question? What was the most memorable good birth you had, and the most memorable not good, like the worst? Can you give those two? Do you remember?
Yes, I do. So the worst one was that 4-minute shoulder dystocia, because I mean to tell you, I don't think I was breathing. And I was very, very worried about the baby. I mean, very worried. And it needed some resuscitation when it was first born, but it was moving both arms and ended up doing fine. But I was just horrified, because I worked through my maneuvers 2.5 times. And usually it takes one set. And when you start wondering, is this baby going to live? And when you're wondering that, that's a scary place to be. So that was the worst so far.
Before you tell the best, do you ever cringe when people are telling their horror stories because
the time.
quite frankly, they don't need to be told to younger women who now have this fear instilled on them.
Right. Yeah. No, don't share your horror stories, please. Do everyone a favor.
With pregnant, especially if they're pregnant, don't tell them your horror stories.
Right. This is when you want to be encouraging, not instilling fear. But anyway, my best was actually, well, can I choose two bests? Because they were very different reasons for being best. So my favorite best was a home birth that I attended for a friend of mine in California. She has 10 kids now. So I caught 2 of her babies. And she totally didn't need me. She had done it unassisted with her husband before, but she was like, hey, you want to come? And then I also was there for the birth of her sister-in-law. But it was the first one. It was just so beautiful. She was in her bedroom, in a pool, unmedicated, and just so serene. And yes, you could tell uncomfortable at times, but just she had it all under control. And she was doing great. And then the baby was born and she and her husband were there. And I'm just like there for the show. Those are the best ones where I just like, I'm not even doing anything. I just get to be there. It's the best job ever. And then help with cleanup and then assess the baby and assess mom. Learned a lot of things from her too. By the way, if you want your placenta to come out quickly, eat chocolate right after you deliver. That's an Amish trick. And I'm here to tell you that it works. And then my favorite.
Wait, you cut out for a second. What works?
Oh, if you want your placenta to come out quickly after you deliver, because some people, it likes to hang on for an hour plus, and then we start worrying about bleeding. Eat chocolate, semi-sweet chocolate or bittersweet chocolate right after you have your baby. That sucker will be out in minutes.
That actually happened to me. It went on past an hour, and she was worried. So she actually did something I was actually afraid of. But it turned out it was absolutely fine. She put a little bit of Pitocin in the cord.
Yeah, that actually works great. Yep. But yeah.
And she was a midwife. She gave Pitocin.
And also, it was a very small placenta. What could have caused that?
I would rather eat chocolate.
And what caused having a small placenta? She kept looking at it going, it's so small. Oh. What is good to make sure like it wasn't healthy or something?
Well,
but
no.
The child was healthy.
Just because it's small doesn't mean it wasn't healthy. So placentas usually grow according to the needs of the baby. So if you had like a highly nutritious diet and you had a great transfer of nutrients between you and your baby, maybe you don't need this ginormous beefy placenta. It's getting enough of everything that it needs through the blood flow that the cord and the placenta are providing. Sometimes we see growth restricted babies with tiny placentas and puny cords, but that doesn't always correlate. But then my favorite other birth was actually in the hospital. She had an epidural, but this is one of the things where she had significant back issues and she had severe pain even throughout her entire pregnancy. And she said, you know, I just think I'll be able to have this baby better without all of the back pain on top of the labor pain. She got an epidural when she chose to get it, and she progressed on. She was very mobile throughout her labor. We had her moving, hands and knees, using the birth ball sort of in the bed, keeping her moving, keeping her upright as much as possible. She was all on board for all of this. And then when it came time, she looked at me and she goes, the baby's coming. I said, oh, okay. And so then she assumed the position that she wanted, which was sort of a modified side lying, you know, holding one leg up type of thing. And I didn't touch her. And she bared down with the urge that she was having. And I see a head start coming. I'm like, well, sure enough. And then I just sat there. And this was the best part. She had her sisters there. And her sisters are all huddled either right over my shoulders or in the corner watching. And every time a little bit of the baby's head would emerge, they'd go, oh. And it was one of those times where I felt like I shouldn't have been there because it was such a magical moment between this lady and her sisters. Her husband was deployed. And then this baby came just quietly and beautifully into the world, right onto mom's belly. And her sisters start sobbing, and I'm just like, This is so good. Yeah. I mean, you can have a beautiful, intentional, and supported birth at home, in the hospital. Depends on what you want, but you just need to find a provider who's willing to go whichever way you want to go with that.
Yeah. And it is a beautiful thing. It just, it's amazing. It's just, wow.
So when are you going to do my next birth?
When are you going to get pregnant?
I'll let you'll be the first to know.
I'm going.
Oh my word.
I usually do end up telling you before my husband.
Are you serious? Oh my word.
I think so.
So I'm actually in a job now where I could travel easily.
Yeah. Well, when I had our last one, we had a little bit of a situation. We're not going to tell the whole story, but our midwife just kind of dumped us and said, "Nope, just go to the hospital." And so we had driven 2 hours away. We had a midwife in Mississippi, and she said, "Your blood pressure is too high. I'm not going to do it." So rather than freaking out and going to the hospital, we called Jessica. And you told us, you said, "No, you've got 24 hours to figure out what to do." And I just kept Laura as calm as possible because, like you said, being afraid isn't good. And we were able to make arrangements in Niceville, about 45 minutes away. And that lady took us because she wouldn't have taken us just on the spot. But because we had been going for all that time, every 2 weeks, 3 weeks, to the midwife, and she called the midwife gave her all the information, and she took us in there. So it was good to have a midwife and not freak out and have to go to the emergency room. We knew what was going on, and we could call you too, and you could tell us.
We talked about at the very beginning is that different states have different laws about what they can handle, and Mississippi can't handle certain things, and so she ended up dumping me, which was horrific. Yeah. But went to Florida, and
wrongly so.
I
think she shouldn't have. It was a healthy birth, but anyway, go ahead.
Yeah. I won't. Anyway, we don't.
The midwife who ended up attending your birth was. She went to the same school as I did. And actually, the very next day, I found her in our Facebook group and thanked her. And I said, "I know what you did last night, and she's my best friend. And thank you so much." And she made crying faces, emojis, and she hearts. And she's like, "Oh, they were so wonderful. It turned out just perfect. I'm so glad I could help."
I cannot picture a better birth. It was a perfect birth.
Yeah, and I got to sleep for several hours before.
Oh,
it was wonderful.
I called him when I was ready. I said, "When I'm ready," and it was about 7-8 minutes before baby came out. I said, "Okay, go get Robert."
It woke me up, and I showed up just at the right time. And he didn't cry much either when he was born in the water birth. And when he did cry, his cry was so small. He's the loudest kid in the world, but when he was a baby, he was not that loud. Yeah.
All right. Well, I could continue with my own stories here, but I don't think the whole world.
Well, it's fun to talk about these things, especially when you're Christian, but also when you're trying to do things the Bible way, but also it really is the best way. And so we wanted to share this with all of our viewers as something for you to think about. And I'm sure I have to say this. I'm not a doctor. Jessica's not a doctor. My wife's not. We are not giving you any sort of medical advice. All we're doing is telling you what we know, where we came from, what we did, and you make your own decisions, right?
That's the best way if you can. Amen. I don't think we're trying to say it's the best way. It's the best way if you can, and it's the best way if you want.
Right. And like I said, even with my first baby, we knew from an ultrasound he had heart defects. Sometimes there are reasons when you need to seek care at a hospital that has different resources than you would have at home. So it's not the only way. It's not the best way for every person, but it's something that definitely needs to be on the table as a conversation when you're talking about starting a family.
Yeah.
And especially when you're talking with doctors, unfortunately, I call it a God complex. You have to be firm with the doctor. You have to tell them what you want, and don't let doctors railroad you to getting.
And oftentimes they'll just say whatever, and they won't. Many horror stories we've heard of women that did have midwives in the hospital, and the doctor came in, bullied everyone, did everything against the will of the woman, and that it's just a bad experience all around. Yeah.
Yeah, it does happen. Again, I'm real blessed to be in the group that I'm in. I actually got to attend the birth for a woman who transferred in from an attempted home birth. And then she just had some issues and concerns and came in. And there were some things that were making the doctor that I was working with that night nervous. And I kept, like, she was in the room over my shoulder, and I was sitting at the foot of the bed, and I would not move. I mean, I was just sitting there, and I was talking to her, and I was like holding the space because I felt like she was doing everything she needed to do. She was going to have this baby just fine. I just needed to protect her space. There's so many things. Sometimes I'm a really active participant as a midwife. Other times I'm just a space holder. And this was one of those moments, and she was standing on the bed actually when she ended up delivering her baby. Caught the baby herself. We did delayed cord clamping, didn't remove the placenta, let her push it out, all the things that she wanted to do at home that we accomplished in the hospital. And then I discharged her a couple of hours later, very similar to what a birth center would do. But you know, the training that doctors have sometimes, I think, and the fact that by default they've seen a lot more bad things than a midwife has because of their skill set, because of their expertise. Yes. They're the ones we go to when things are bad. So they see more, and I think they fear more. And that comes across even in normal, healthy deliveries at times, not always. Sometimes we have a great crew, but other ones are nervous Nellies, and it shows.
Yep. Well, I think we need to cut this off. We've been going now for about 2 hours. It's been wonderful. Thank you, Jessica, for coming. I feel encouraged talking about this, and I hope it's encouraging other people. So thank you. Is there anything you want to say in closing statements? Then I'll let Laura say something.
No, I mean, thank you guys so much. I'm passionate about my job. My life's work, you know, and I love talking about it and sharing it, and, you know, do your research, do your due diligence. Any other thing in life, if you're buying a car, planting a garden, doing any other thing that you do in life, you hit the internet and you look up everything you can find about it, all of the reviews, all of the options, you know, all of the packages. Yeah. But when it comes to childbirth, you just say, get my baby out of me. You know, don't do that. Be that informed consumer. Advocate for yourself. Advocate for your family, your sisters, your cousins, all of the women in your life, and encourage those conversations that need to be had.
Amen.
And while YouTube is still pretty much free speech, check out all those videos. You get there isn't anything you can't learn on YouTube right now.
Right. Well, Laura, what do you? What are your closing statements or whatever, Laura? What would you like to say to close this thing off?
What we initially started with was our people are destroyed for lack of knowledge, and now some people, whoever watched, has options and knowledge, and they can maybe go through life with a little less suffering because of it. Right. And it really is a spiritual battle, so pray about it and do your studying.
Amen. And I would close with Titus chapter 2. If you get a chance, read Titus chapter 2, how it talks about the aged women are supposed to teach the younger women certain things. And I think today we had women teachers. And that's not wrong, because it's supposed to be more directed to other women. Okay. So this was for women that have contacted me and asked about this. This is for you, but also guys can listen to this and get an idea also as well. And I love talking about this kind of stuff. I don't know why. I just, to me, it's cool because I've been there, and it's, to me, not gross. And some guys will not talk about this kind of stuff. But if you're married and you're going to have a kid, you're going to be there. And then maybe someday we can talk about it.
And not talking about it is the worst thing for everybody involved.
Right. So that's it. We want to thank you again, Jessica, for being here. Thoroughly enjoyed it. And I know this is above and beyond because you are probably super tired. So but you did a wonderful job, and we just thank you so much for that.
Thank you for the opportunity.
All right, we're going to cut it off here. So thank you, everybody. Lord willing, we'll try to be here next week, 6 o'clock, and have a different one for you.
I'll come back now.
Yep. Bye-bye.